Hi, I am Linda, the creator of information about arthritis. If you are new to this channel, remember to subscribe. Just click the subscribe button below and then click the notification bell to receive notification of new videos when they are released. There are more than 100 types of arthritis with different causes and treatments. Two common ones are osteoarthritis, OA, and rheumatoid arthritis, RA. Arthritis is a disease that attacks your joints, giving you pain and inflammation. Also, your immune system could be attacked. Other symptoms are swelling and stiffness, and unfortunately, the symptoms can affect more than one joint. Also, the disease is incurable, meaning that all you can do is treat the symptoms and not the disease. Arthritis typically develops in adults at the age of 65, and it's mostly in women than men. Also, it could develop in people that are obese. And children and young adults can develop this, which is called juvenile idiopathic arthritis, JIA. The symptoms of osteoarthritis are joint pain and stiffness, which can be challenging to move the affected bone. These symptoms can come and go, which can be connected to the activity that you are doing. Also, I have discovered that I am in pain due to the weather. I find that it is more painful in humid weather and rain. You may have tenderness of the joints, or increased pain and stiffness first thing in the morning or when you have not moved your joints for a while. The affected joints may appear slightly more significant or knobbly than usual. You will hear a grating or crackling sound when you move the joints. Eventually, you will have a limited range of movement in the affected joints. And your muscles will become weak and waste away. When you develop osteoarthritis, the large and small joints can be attacked, but the most common joints are the knees, hips, and hands. The pain or inflammation you experience could be in one joint or more than one at any one time. If you have persistent symptoms, it would be best to see your doctor to confirm the diagnosis so that they can prescribe any necessary treatment. But if your immune system is attacked, it could be rheumatoid arthritis. The symptoms of this disease could be like osteoarthritis, such as pain in the joints, but can also include feeling fatigue, fever, and loss of appetite. Early signs are that it tends to affect your smaller joints first, especially the joints of your fingers and toes. As the disease progresses, symptoms often spread to the wrists, knees, ankles, elbows, hips, and shoulders. In most cases, symptoms occur in the same joints on both sides of your body. Other symptoms do not involve the joints. The areas that may be affected are the eyes, skin, lungs, heart, kidneys, salivary glands, nerve tissue, bone marrow, and blood vessels. The symptoms can vary. They could come and go, or periods of increased activity called flares. Also, rheumatoid arthritis, over time, can cause the joints to become deformed and out of place. It would be best to see your doctor when you develop pain, stiffness, or inflamed joints for more than 2 weeks. First, your doctor will examine your painful joints to see if you have fluid around them. You may need a blood test showing 3 specific types of antibodies: anticyclic citrullinated peptide, rheumatoid factor, and antinuclear antibody. Also, you may need an X-ray, MRI scan, or CT scan. These will show joint damage. Your doctor may send you for some physical therapy that involves exercises which help to strengthen the affected joint muscles. Your doctor can also help you set a target weight and design a program to reach your target. Managing your weight is an essential element of arthritis symptoms. When you become overweight, you are putting extra weight and pressure on your joints. Especially your big joints, such as your knees, hips, and feet. A healthy diet of fresh fruits, vegetables and whole foods can help boost your immune system and become a healthy weight. There was a study that showed dietary choices can affect people with both osteoarthritis and rheumatoid arthritis. For example, plant-based foods have antioxidants, which help reduce inflammation by reducing free radicals in your body. On the other hand, rich red meat, processed foods, saturated fat, and added sugar and salt make inflammation, therefore, making your arthritis worse. Also, these foods can contribute to other health conditions such as obesity, high cholesterol, high blood pressure, heart disease, and other problems. Getting enough exercise can help you to manage your weight, keep your joints flexible, and strengthen muscles around your joints. It will give you motivation if you exercise with a trainer or another person. Good exercises include the following, which are low impact. Weather permitting, walking is good. Go to the gym and use their treadmill or cycling machine, but ask someone if you need help using them. Or you could find a local yoga class or swimming pool. Doing both activities, exercise and dieting, will help in two ways, keeping your joints flexible and your weight down. You can use hot and cold therapy. These can help with relieving the symptoms of pain or inflammation. Heat treatment could help by having a warm bath or shower in the morning. It will help to ease the pain. You could use an electric blanket or a hot water bottle, or what I do is have a heat pack in bed on my pains to reduce discomfort overnight. Or a cold treatment can help relieve the inflammation and swelling. Wrap a gel ice pack or a bag of frozen vegetables in a towel. Apply it to the inflamed area, but do not apply ice directly to the skin. You can get an over-the-counter ointment that comes in a cream that provides warmth and soothes joint pain. Try and reduce the stress on your bones by reducing your weight, as this can also improve your mobility and decrease pain, which prevents future damage to your joints. Try acupuncture. It is an ancient Chinese treatment involving thin needles inserted into specific points on your body. Acupuncture or massage can help. I have tried acupuncture for my osteoarthritis, but it got too expensive, as you need to go to a certified acupuncturist and a certified massage therapist. You could also try meditation and relaxation techniques. It may help with lowering your stress and allowing you to cope with the pain better. Some spices can also help. Turmeric is a yellow spice common in Indian dishes. It contains a product called curcumin. It has anti-inflammatory properties in it. Research has found that it could help reduce arthritis pain and inflammation. But more research must be done to show how turmeric works, but adding a small amount to your dish is likely a safe option. Herbal supplements can help reduce joint pain, but research has not confirmed that a specific herb or supplement can treat arthritis. Some herbs include boswellia, bromelain, devil's claw, ginkgo, stinging nettle and thunder god vine. Always talk to your doctor before trying a new supplement. Some can cause side effects and dangerous drug interactions. For the rest of this video, I shall show you 5 different types of arthritis and their causes. The first one is rheumatoid arthritis. This one can be challenging to diagnose as there are many factors. It could cause your body to attack and destroy your bones and joints. Also, it can attack your healthy immune system. And can cause red blood cell count to decrease, which means you may become anemic. Another cause could be inherited by the genes, meaning a family member having the disease. The disease can also develop in organs such as your lungs, heart, eyes, and other organs and is irreversible. The inflammation is produced by extra blood flowing through the area where it is fighting the infection. The second is osteoarthritis, which is the most common. It is also called wear and tear of the joints, as it can develop by using the joint constantly, or you could have a fall. The early stages of osteoarthritis begin without much pain or worry. But unknowingly, your joint can be damaged. Until the pain and inflammation worsen around the knee, hip, hands, and back joints. It has been found that osteoarthritis is more common in women than men and affects people over 45. As it is incurable, you need to keep up with exercises, as it keeps the muscles around the joints from weakening. I developed osteoarthritis when I slipped on some ice going to work. I did not think anything of it then. But about 7 years later, my right hip and leg ached so much that I saw my doctor, who sent me to the hospital. They diagnosed me with osteoarthritis, and it was so bad that I needed a hip replacement. Now I have a right hip replacement, and the arthritis is now traveling all over my body, in both knees, shoulders, fingers, and ankles. You may not know, but gout is also a type of arthritis that attacks your big toe. But it can be in your ankle, foot, or knee. Or in some severe cases, you could develop the disease in your small joints like your wrist, elbow, and even your fingers. Gout is a form of rheumatoid arthritis, which is an inflammatory disease. Meaning that you have too much uric acid, which is a chemical that is formed when your body breaks down certain food materials that are called purines. The uric acid that crystallizes in your joints causes the pain to attack. These crystals can form kidney stones and cause severe damage to the kidney. You could also develop gout if you are overweight or drinking alcohol and overeating certain groups of foods. Gout is also common in women after their menopause. Men could get it from their mid-20s. Another type of arthritis is ankylosing spondylitis, which is a type that can cause pain and swelling around the joints in your spine. It happens because you create more mineral calcium than you need. Calcium is good for you as it makes strong bones, but if you have too much calcium, the extra will make new bits of bone growth in the spine, causing pain and stiffness. The disease can be found in adults aged 20 to 30 and is common in men. If you do nothing, you may end up with a curved spine. Spondylitis is more painful and stiff in your spine when you have lied down all night. The last one is where children can develop arthritis called juvenile idiopathic arthritis, which starts with joint inflammation. If your little one has developed this disease, they could have it until their 16th birthday. Your child could have osteoarthritis of the joints or rheumatoid arthritis, an autoimmune disease and swelling in the joints. Arthritis is a terrible disease that can develop at any age. It happens because the cartilages in the joints wear down from everyday use. The cartilage destroys more and more as we get older. So around the age of 45, your joints could develop osteoarthritis. And at 70, you could develop it in the hip, especially if you are overweight. But rheumatoid arthritis is a chronic autoimmune inflammatory disease which also affects your joints. And unfortunately, it can end up with joint destruction and deformities in the affected joint. Rheumatoid arthritis can also cause multiple organ systems outside the musculoskeletal system. Always consult your doctor if you have any worries. I hope this has helped you, and good luck. If you would like to know anything about arthritis, just send me an email and I will get back to you. I am not a medical professional, and the information in this article is for information only. Linda.